So thanks very much everyone for coming to our Quests webinar for this semester. So we're really delighted to have Professor Sean Deneen and Dr. Colin Casey from NUI Galway here to talk to us about the D1 Now project, which has been a really exciting project and has had so much really positive actual patient and public involvement in it. So I'm going to hand over to the team to talk about it. So Blocking, if you'd like to kick off there, and hopefully we can all hear. We'll do a bit of a Q&A at the end as well. So if anyone's online and wants to do Q&A, you can do the Q&A function on Zoom.
Brilliant. Thanks very much. Thanks very much, Elaine. This is my first webinar virgin. So I hope everybody can hear me online. And thanks to everybody in the room. Not too sure if we just came from upstairs or down the corridor, but we braved it across to school of psychology. I did have my hair done if I was going to be on video today, but I now have it tied up in a type 1 for those of you online. Perfect. So yeah, this is probably going to take about 40 minutes or so, and then we leave room for some questions at the end. So discussing today our HRB funded DFA, so Definitive Intervention and Feasibility Award, D1 Now. So I have a couple of learning outcomes that I'm hoping you're going to get by the end of this webinar. The first one is I'm going to hand over to Sean, and he's going to define what PPI is, so patient public involvement, give you some examples of what PPI isn't as well. He's then going to discuss the background to the D1 Now intervention, how it began before we got funded by the HRB, and the involvement and development of our PPI panel, our young adult panel, so a group of young adults living with type 1 diabetes. Then going to hand back over to me, and I'm going to bring you through how our young adult panel, or what we call the YAP, have helped me big time over the last couple of months. I started last February on the project, contribute to the qualitative component of the intervention, where we've been kind of refining and developing the intervention components in D1 Now. I'm going to tell you a little bit about the roles that some of our YAP or PPI members have taken on throughout the last couple of months as well. So I'm going to hand over to Sean to start on PPI.
Great. Thanks, Blocking, and thanks to Quests for giving us the opportunity to highlight our work, and indeed thanks to Quests for their help over the lifetime of the project, and here that has been substantial. So if I'm honest, although I'm locally at least, I'm looked on as the PPI, one of the PPI experts in NUI Galway by virtue of our Ignite Award. If I'm honest, I'm still learning in this whole space, and I think it's an area, public and patient involvement in health research, which is relatively new, certainly in Ireland, and we're all, I think, getting our head around it. It's further along or more embedded in other health systems, in particular our neighbours in the NHS and the National Institutes of Health Research have really, I think, incorporated public and patient involvement very much into their processes. One of the nice things, I suppose, about not being first to adopt is you can learn from, the good things and maybe some of the things that they might have done differently, and I think that's where we're at. But today I'm just going to start by offering a definition of public and patient involvement. This is taken, many of you working in this area will be familiar with Involve, an organisation in the UK that leads out on PPI. And the phrase that people use is that, public and patient involvement, if it's done well, is about, research being carried out with or by members of the public rather than to, about, or for them. The phrase "nothing about us without us" is often used and tries to capture this imperative of having public and patients involved in all aspects of the work, shaping the research priorities, looking at how you frame the questions, doing the work, and so on. And that's captured on this next slide. So there are increasing levels of public and patient involvement from none to just disseminating or providing information through more robust and more rich consultation throughout the research process, and right up to, and I don't think any of us have yet, well, certainly that I'm aware of in our university, reached this point of actually having what the diagram here calls full control, or public and patients initiating the research and actually leading the study. I don't think that we necessarily need to get to that, upper level. I mean, it's really for every researcher, for every research group to look at their own work and try to, think through how it can be, how the quality of the research can be improved. And the story you're going to hear from us, I think, is a good example of, without a doubt, the quality of our research, the fundability of our research has been hugely enhanced by our young adult panel. So where are we on this? Probably we're certainly not at the bottom, but we're not at the top. We're somewhere in the middle. Maybe you can judge that for yourselves when you hear the story. Okay. So I just mentioned or given you a definition of what is PPI. I think it's important to highlight what it isn't. This is not meant to be criticizing people or pointing a finger. It's just, there are different perceptions out there, without a doubt. And I think, as I mentioned at the beginning, I think we're all learning. So it's not just about recruitment of study participants. I think that's, that's for sure. It's not just about work aimed at raising awareness among the public around research. It's not qualitative research or interviews conducted by research. Of course, that requires patient and public involvement, but that's PPI is more than just that. What we're going to be exploring in this webinar is that interface, of course, between PPI and qualitative research. And in terms of medical devices, which is a big part of our research agenda here in NUI Galway, it's not just usability testing at the end of the process of developing a new device or new technology. So some of you will be aware of PPI Ignite, funded by the Health Research Board in 5 higher education institutions in Ireland. We're fortunate to be part of this group of Ignite centres. Idel Murphy is leading the program, is managing the program here in NUI Galway, and although we're early in the process, I think it's been a rewarding project even in the first 6 months. It is very much about getting people to think differently about the whole research agenda, and ideally including, just like you can't do a research project without research ethics approval. If we were to fast forward for 10 years, my way of thinking about PPI is that it would be bedded in like research ethics, and why? Not just because you have to do it, but because it adds value. So in terms of the second learning outcome that Láithín has set for us, it's around the background to our project D1 Now, as we're referring to it, and the development of our panel. So I'll take you through that. I'm a diabetes doctor, so within our world of delivering diabetes care, there's many different sort of subspecialty areas, if you will: pregnancy, diabetic foot, and so on. One of the areas that I participate in our clinical practice is young adult diabetes care. Quite challenging, as I'll explain in a moment. Moving forward, it's okay. Yeah. So, but just for those of you not familiar with type 1 diabetes, it's much less common than type 2 diabetes, which is largely responsible for the so-called pandemic of increased diabetes prevalence worldwide. Type 1 is a relatively rare condition, an autoimmune condition characterized by lack of beta cell function and complete insulin deficiency. It requires a lot of self-management. The person living with type 1 has to juggle their food and activity and how much insulin they take with the various stressors that we all deal with. We don't know for sure how many people live with type 1 in Ireland, but it's probably in this ballpark on the slide. And it's typically diagnosed in late childhood, early adolescence. So a lot of people living with type 1 develop it in this challenging phase of the life cycle, which is variously termed emerging adulthood or young adulthood. I really like this slide with the head, which we borrowed from our colleagues in Jigsaw Galway. And what it highlights is the fact that, yes, of course, type 1 diabetes is in your head. You know, if you're living with it, it has to be something you think about, but there's an awful lot of other things in the person's head as well. And you can see some of them here. So the beginning of this journey for me, or for us as a team, was very much in Lisa Hines' work with Molly Byrne, looking at one of the problems with our young adults is they don't come to clinic. So we don't see them, 30 to 50% non-attendance, which is really quite staggering and would not be unheard of in our young adult clinic. So our diabetes nurses end up chasing these young adults on the phone or by email or whatever, hoping and that they'll respond and trying to figure out how they're getting on. Lisa spent her PhD studying this phenomenon and did some really nice work on barriers and facilitators to young adult attendance. Huge part of what she identified was this idea of a relationship. Building a relationship with the young person is much more likely to have them engage and participate. You could say, well, isn't that obvious? But I suppose it does take drilling down into it to actually identify and clarify that. The other work that we've done, led by Mary Claire O'Hara and Lisa and others, was looking at, before we got into developing a complex intervention or a new approach, what's out there? And the answer, to be honest, is very little. There's been very little work done in this area. The work that has been done has been of not great quality in terms of certainly no randomized controlled trials of new approaches or new interventions to reach out and engage with young adults. So this systematic review was published in Diabetic Medicine a couple of years ago. So when we set out on this journey, we realized that, you can probably tell, I know the webinar people can't see me, but I'm not a young adult. Okay. I used to be, but and for us to come along with a sort of a solution, it ain't going to happen. That's the truth of it. So from the beginning, and very much modeled on the Jigsaw youth mental health approach, we reached out to our young adults. That's the ad on the slide. The ad is on the left of this slide. And the first meeting of our young adult panel, or actually this was even a pre-YAP meeting to discuss the idea, happened in Jigsaw Galway's offices. And it was, from the beginning, I would say, a very rich and a very enriching kind of association for us, bringing our young adults on board, getting their perspective on the lived experience of type 1, and having them help us to imagine or reimagine what diabetes care might look like. So this is our young adult panel, version 1, I guess, and version 2. And I think that's the story that Blahin is going to take you through now, how they have worked with us as co-researchers in the development and hopefully the evaluation of what we would consider a new approach to delivering diabetes care. So we described this work in some open access journals, including HRB Open Research, which may not be on here, but a couple of open access papers that are on here talking about the development work of young adults. We've also had fun along the way, in particular on the day of Brexit, the weekend of the Brexit referendum. Molly is nodding and she remembers it well. We had a thing called a hackathon, which I had not heard of before, but it's an idea that comes from the device or the kind of technology world, where you bring people together, tech people working in the area that you're trying to develop a new technology, and then the users, or in this case, people living with the condition. And it was fantastic. Came up with various ideas, including some of the elements of the complex intervention that Blahin's going to describe now. So I think that's me handing over to Blahin. Yeah. Great.
Perfect. So back over to me, and I suppose it was nice that Sean gave that introduction, because as I said, I'm new to the project, and a lot of work, as you can see in the date of that advert, was 2014. Here to tell you the story about where we are from when I began in February, following on from what Sean has discussed. So the work was done, systematic review was highlighting there's an intervention to follow in terms of developing or improving outcomes among young adults with type 1. We had now our YAP engagement. We had a young adult panel developed, and we, through the hackathon, had developed the intervention, or what we thought the components of the intervention might look like, and that was named D1 Now. So in terms of the intervention, D1 now, it has 3 intervention components. So I'm just going to quickly go through this and then get into kind of the real nuts and bolts of the qualitative roles and what the app have been doing in terms of that. So 3 components: a key worker, an agenda setting tool, and Florence. So Florence is it's a text messaging app. So it was developed by the NHS, Simple Health. So it's a text messaging app where you can set up different algorithms for messages that you can send a person. Based on their response, they'll get a response back. So for the young adults with type 1, we have blood glucose monitoring messages. So I'm not too sure if the guys in the room here can see this. Maybe you can at home. But basically, the young adult gets a message saying, hello, just a quick reminder that your pre-breakfast blood glucose reading is due. The young adults then get back the blood glucose reading. And based on their response, they'll either get back a, that's good, thanks for sending that back, or that's below the acceptable range, and then they'll give a little bit of information on what to do about that. It's above the acceptable range, or else it actually really exceeds the critical threshold for what your blood sugar should be, and they'll get a more urgent reply. So that's Florence. We're working through that, and I'll tell you a little bit about what that's looking like at the end. But it has blood glucose, as I said, messages. It also has some motivational messages that we send the young adults as well, and an alcohol reminder message for the young adult gets to choose what day they get that message, or if they want it at all, asking them to be safe when they're out drinking if they are. Second component is an agenda setting tool. Probably to all these intervention components, but probably my favourite, and Sean, I think yours as well. So this was again developed by Patrick Chowdhury, who's a diabetes doctor in London. Again, works with the NHS and in King's College. And what the agenda setting tool is, it's a 2-part tool that the young adult comes into clinic and they fill out the first part. You can see the first question here, which is the most important. It's asking the young adult, what would you like to discuss today at your appointment? So Sean, you might close your ears, but I've been to consultants before and doctors, and I think oftentimes you might go in and you don't know what you're going to discuss, and you might be led through different questions and that. So this is just a nice way for the young adults to take some time before they go into the doctor and think about what they want to discuss today. It has some other important questions on hypos, so low blood sugars, which we call the gold score, and then question 8, a question on diabetes distress. So this is a 2-item questionnaire around diabetes distress, asking the young adults if they're feeling overwhelmed by the demands of diabetes, and they mark that from not a problem to a very serious problem, feeling with their diabetes routine, and again from not a problem to a very serious problem. So that's our agenda setting tool. The second part then is they come into the doctor and the nurse, and they discuss the findings that were on part 1. The third component is the key worker, maybe the most undefined component at the minute, but we're definitely getting our heads around it, and the qualitative work that we've done has helped us do that. So Sean mentioned that the work that Sean and Molly and Lisa Hines had done around non-clinic attendance, relationship building was something that came up, and having that person in the clinic or maybe outside the clinic to kind of bridge that gap between why they're going or why they're not, and that for us is the key worker. These are some of the key kind of findings about who that key worker is going to be. Young adult centre, as I said, relationship building, improving engagement, that contact between appointments. So we haven't hired this person yet. They're going to be hired for the pilot, specifically for the pilot. And we'll come back to you when we know exactly what that person looks like. So in terms of the grant that was put into the HRB, the DFA grant, there were 4 worker packages. And at the start, I suppose Molly and Sean and co-applicants knew what the D1 intervention looked like in the sense of the 3 components I just introduced. And the purpose then was to move through these phases. So the first was really to develop and refine those intervention components, then to move into feasibility testing of the intervention package as a whole, to then get us to our clustered randomized control trial, with, you can see, work package 4 down the bottom, really having the young adult panel as co-researchers throughout, and that was a work package in itself. Learning outcomes, and I suppose now I've introduced the D1 Now intervention, just give you a little bit of a picture about what that looks like. And I'm now going to go on to tell you how our YAP have been involved with me in that kind of developing and refining the work package 1. So when I first started, I was asked that was my key kind of task, was to develop and refine these 3 intervention components. And I set out a plan for the next couple of months about how I was going to do that, and that was through 4 different rounds. So the first round with each of the intervention components was to go to the healthcare professionals, ask the healthcare professionals what they thought about these 3 intervention components and any ideas around refinement or development of those. The second round, the exact same, except this time in young adults. The third round, using Florence, the text messaging app, and the consultation tool in a real-life clinic setting in Galway, and with the key worker coming together with the findings of the healthcare professionals and the young adults, and trying to really hone down who this key worker is going to be through a steering group meeting, with the 4th round then moving into our feasibility trial. So I was with Deirdre, but we wanted extra involvement and had asked her YAP. I suppose the most important thing is that we asked her YAP, would they like to be involved in this process? I'll talk about some members that did and said yes, and other members that said no, I 100% do not want to do that, and that's perfectly valid as well, and I'll give you some quotes about their reasons behind that maybe as well. But to have the young adults involved, so the PPI contributors, they have to have the skills, they have to be equipped to be able to do what you're asking them to do. So if I was to ask them to get involved with me through some of these rounds and qualitative stages and interviews, I needed to give them the skills to be able to do that. So that's when we came to guests. So there we are, looking on happy, Deirdre and myself, and we had 5 young adult panel members there, and we have Andrew and Catherine. Louise Murphy as well on the day. So we met with Quest. We were here in a room similar to this here in Ars Miola for about 2 hours, but we did have a pizza break and some coke within that workshop as well. And this was the session plan that Quest had outlined for us on the day. So Deirdre, while she was program manager at the time, worked closely with Quest and I suppose for the workshop. So we went through each of the app's current experience as researchers in qualitative methods. For example, one of the app members is actually a PhD student and nearing the end of PhD, as opposed to maybe another app member who has no involvement in research, qualitative research in particular. Then went through the needs of the app by outlining, I suppose, why this qualitative research was needed. So I talked through my plans about what I needed, and Louise and Andrew then kind of asked the app what needs they needed based on that, and then went through, I suppose, the role of qualitative research with a bit of a background to that. So that was conducted sometime spring last year, I think, Andrew, which seems mad and seems like not so long ago. So after that workshop, we'd sat in the room for the 2 hours and we got all this information, and we then, what we do when we have workshops and things like that, is we come back and we debrief afterwards. So we have our YAP meetings. We tend to have them monthly or every 2 months. So we had a YAP meeting fairly soon after that. The main kind of discussion point of that meeting being, what did you think about the Quest training? Do you think you'd be equipped enough now to help me out with what I'm asking you to do, and so on? And we decided within that meeting that we had enough tangible kind of evidence and background information around qualitative research to now sit down together as a group and define different potential roles for the young adults and what they could have helping me out with the qualitative components. So we did that, and the result of that meeting was we came up with 4 different roles that the app members could have as qualitative researchers. And for each of those roles, we outlined what they needed before they took on that role, what the potential benefits and challenges might be of each of those roles as well. So what I'm going to do is just bring you through each of those roles and what myself, Deirdre, Sarah Simpkin from Jigsaw and the app members came up with. So the first role was the logistics coordinator. So this person basically was, while I was making sure I was ready, had my interview schedule ready, and was prepping myself, as Deirdre says, giving myself the rocky prep speech before I went into the focus group room. The app member was logistically organised, had people arrived. If they hadn't arrived, they had access to their numbers, and my phone, and they were bringing people if people were lost. It did so happen that someone was lost. and the app member went and got the person. So that's kind of the logistics coordinator, helping me with printing and signage if I needed to as well. So we said in terms of the training that they needed for that kind of role, the current training from Quest was sufficient definitely for that. The criteria, so the person definitely needed to be open and flexible in terms of completing the tasks I was asking them to do. So they couldn't say, no, I'm not going to do that. So they should be open, and if I want them to go do something in an unforeseen circumstance, like when the person couldn't find their way, that they were happy enough to be able to do that for me. And they were definitely open to meeting new people as they arrived, and those kind of hosting skills, and be able to make some small talk, and we get them some tips on maybe talking like today about the weather or whatever it was. The benefits, I suppose, it's a nice way to participate in the qualitative research without the pressure of leading the focus group or having to ask questions or debriefing afterwards. And I suppose a challenge that the app members came up with, that it might be hard to make small talk, and it can be, some people aren't comfortable with that. I quite like it, some people don't. So yeah, just to have that as a challenge as well. The second level then was a field note coordinator. So this is the person that's in the room with me, and I am leading the focus group, but they're taking notes, and we meet afterwards, and they debrief and provide me with their field notes. So we definitely think that the Quest training was enough to allow them to be able to do this, but if the person did feel they needed extra skills, either a top-up session with myself or Deirdre, or a little bit more, we could do that. We thought about maybe running another workshop, which hasn't transpired yet, around kind of top tips for running a focus group. The criteria needed for that, they definitely needed to have good listening skills, and the ability to be able to write down what they were hearing as well. But we made it pretty clear that you didn't need to have perfect handwriting or perfect spelling, that as long as you could understand it and feedback in your own words to whoever was leading the focus group, that would be fine. Benefits, so it can be really interesting to just sit back without the pressure of, again, asking questions and take your notes. But again, a challenge, I suppose, that some of the app members, they were asking, how long is a focus group? How long? And I was like, how long is a piece of string? But it depends. But roughly speaking, 60 minutes or an hour and a half it could be. And they were like, oh God, yeah. So just a challenge maybe that they thought was being able to listen, and I suppose for that period of time. Third and second last one is a debrief facilitator. So this person took field notes as well, but what they did was actually at the end of the focus group, I'd come to them and I'd say, Andrew, what are your thoughts? Do you have anything else to add from the discussion that we had today, and some of the field notes that you've taken during the focus group? So training, they definitely need to have the Quest training completed. But with this one, we felt that they probably needed a little bit more. They probably needed to come back to myself and Deirdre and just make sure they were ready, giving them some of the top tips that they might need for that. The criteria needed, so they needed to be happy enough to be able to speak in a small group and be able to summarise what was said in the focus group in a couple of sentences, which actually can be really, really hard, summarising an hour and a half of what had been said into a couple of sentences. Some benefits of that, it can be difficult to listen throughout and then choose the most relevant items you would like to bring up or summarise at the end. So that can definitely be challenging. And then a benefit, it can be quite rewarding, obviously, to take an active part in a focus group. And then the final one, and it's the only one yet that we have a YAP member to participate in, but I'm hopeful because we have lots of stuff happening in the next 12 months, is for a YAP member to actually co-facilitate a focus group. Training as previous with level 3. In terms of the criteria, they need to be able to follow my instructions, I suppose, follow the leader. Need to be able to put aside personal opinions and not ask, I suppose, leading questions, which some of the app members openly said that they would find quite difficult, especially when you're sitting in a room and discussing something that's obviously very close and personal to you. It can be difficult to keep it quiet. So some of the benefits to that, so being able to do this is a seriously transferable skill for not just research, but in the workplace, and something good to have on your CV as well. But it can definitely be difficult, as I said, to keep some of those thoughts to yourself and keep it quiet. So they are the 4 roles. So this was done prior to me, kind of in the middle of me, and I was in round 1. So the young adults took part in this training and came back then in round 2, and I asked, would anyone, after the Quest training and after setting out these roles, would anyone like to help me out with round 2? So the focus group around the key worker with the young adults, Florence and the agenda setting 2. In terms of what has been done, Deirdre was mad for these selfies at every event we were at. I think, I don't know if you've been in one, Sean, but yeah, maybe. So there we are doing a selfie after the quest training. So in terms of what has been done, so 2 YAP members have observed a focus group, so meeting that level 1, and 1 YAP member has taken field notes and then gone on to debrief, so level 2 and 3. And all YAP members, so while not maybe actively taking part in those roles in the focus group and interviews, all have contributed some way to what we were doing through the development of the interview schedules. And there's plans in the new year with all the results from this to come back and to, as a group, analyze the data. So just some quotes from the feedback from 2 of the YAP members that took part. So the first one, so my experience of observing the focus group was really interesting, to listen to the answers to the questions that we as a group had set up. So that was really nice. So we had worked together for 2.5 hours in Jigsaw, setting up in particular the key worker focus group transcript, which I'll show you in a minute. And they'd really helped me develop that. And so that was nice for them to be able to see some of the answers to the questions that they put together. The next one, so to hear the responses, which were similar to my own experiences, was soothing, but very hard not to participate in this conversation. So that young adult that observed the focus group has most definitely said she doesn't think she's going to go up the levels. She found that really hard, and was a little bit distressed actually by some of the stuff that was taught, because she couldn't add to it, and she found it hard within the focus group holding that in. So that was definitely a learning point for us. And then the last one even, I found it good to get the quest training and then put it into practice. I enjoyed being involved, but also to prepare and organise behind the scenes. The focus group is a unique opportunity rather than always being the focus group. So these young adults have been used now to being participants in the focus group. And Sean introduced that at the start, what is not PPI, and that's the slight difference. So research participants as opposed to, so being in the focus group as opposed to observing the focus group or debriefing or facilitating. So this is just an example of the work that we did. I came to them with the key worker interview schedule, which I'd done with the healthcare professionals, and was happy with how that went, and maybe foolishly thought I would do something similar then with the young adults. And I was going to keep it very open, because we didn't know much ourselves about the key workers. So I was going to keep it very open, and what do you think, with a couple of kind of key questions. And that was absolutely ripped to shreds by the young adults. And we developed actually a very detailed interview schedule and transcript. So they said, we do know what we want from the key worker, the box that I introduced at the top. And they said, why don't we go through each of those and ask a couple of key questions? So with the young adults, so firstly, what do you picture when you think of a professional, healthcare or not, who works well with young adults, and so on. So that was really useful, and just a concrete example of how they got involved with that. But just maybe a couple of things to consider. So as I said, you definitely need to ensure you have adequate training for what you're asking your PPI contributors to be involved in. It takes a lot of time. So definitely it would have been a lot easier for myself and Deirdre with those focus groups, just for the 2 of us to go off and do it. We have the skills and we've done them before. So it does take time if you want to get the PPI contributors involved. You need to meet them beforehand to make sure they are ready. So therefore, yeah, probably an extra demand on the research team because of that. And then, yeah, so do PPI members even want to be involved? So do they even want to participate in and help you out with qualitative stuff? So these were just 2 of the young adults that couldn't take part, and just for different reasons. So the first girl actually really was interested, but she was just busy with work, times never suited. I wanted to, but not possible. And that's the story of the young adults, busy with work and whatever else is happening in the evenings. And then the last guy, very funny, he just doesn't quite get across how he said that, but he was like, not interested, no way. I'll help you when the analysis is done, but the thought of sitting in a room listening to people and maybe having to say something, not interested. So it just shows, I suppose, that you need to ask and that as well. So where to next? So we've done that developing and refining piece. As I said, we're in the middle of analysing that. We've Dr. Emer Morrissey just joined the team to help me out with that. We're in the middle of the feasibility piece up in Castlebar with plans to start the pilot in, Elaine's like laughing. It's all ahead. The pilot in September next year, 2019. And then I'm just going to leave you on this. So Deirdre was a hell of a lot more creative than me. I'd be quite practical if you ever see my qualitative stuff that I've done, my teams are very much barriers, they're very much, like that, whereas Deirdre's, she's very flowery and I love it. She's so creative. So with the young adults, she developed this. It was Deirdre's pep talk or Rocky speech to the young adults if they were to take part in the qualitative research. So I like it. So have no fear about participating. We are trained in all of these methods and have used them over the last number of years. It's our job and we will make this work together. One different question does not ruin a focus group. So the young adults were quite afraid of that. You are welcome to attend the training before you sign up to a role, or even if you would like to attend out of interest. We will touch base with each of you afterwards, consider the role you're interested in, and make sure you're ready for that role. If we assign roles to you, we are confident that you have the training and ability to perform the role well. If there's something you can work on, we will give you feedback. We will always tell you, so don't be worrying. Everything is a learning curve. Each new focus group brings something new, even for us, definitely. We will be there at all times as your safety net. We will act as a team, giving one another feedback and checking in for the focus group. We have a debrief following each group, so we can get most of the experience. Blowing is leading at all times. I'm like dictator there, but leading at all times. We are just there to back her up, her wolf pack, if you will. We will have the ability to pause at any time for a refreshment break if there's any concerns. If BC, myself, feels the need, she can pause and touch base with us to ensure we're all performing our roles in the best way possible. We are the research team. We must ensure insofar possible that all participants, the other young adults, are comfortable at all times. So I'd like to particularly thank, so obviously Sean, who's here today, and Molly, and most importantly, Sarah Simpkin from Jigsaw, who really helped us define those roles and bash out those roles, and Deirdre Walsh as well, who recently left the team to begin a lectureship at ONIT. And just the rest of the team, we have a big group as well involved in D1F. So thank you very much.
Just want to say on behalf of Quest, just thank you so much. It's brilliant and it's been lovely to see, because we had Sean and Deirdre do a webinar last year, I think, and it's been lovely to see the progression then to this one. So it's been progression. There's been so much progression. Yeah. So might open the floor first of all to the room here, and if you could try and be as loud as possible with your questions, and then I'll just go and see if I can find the online questions if there are any. So any questions from the room to kick us off?
Do you have a key, so looking at that involvement in the qualitative work today, is there a key angle that was taken, or emergent finding from that you think just wouldn't have happened without the app being involved? Is there something that really stands out for you?
Yeah, well, I think it's hard to know when we didn't do them without them, but I think the answer is yes, there would have been, because all of my interview schedules ended up looking very different when I came after the app, and mostly I suppose the concepts were still the same really within it. So I don't know if we would have found anything too different, but maybe just would have made the interviews and focus groups easier for the participants, the way things were worded and that kind of thing. But yeah.
Yeah, I would agree. I think, we tend to do things in clinical medicine the way we do them. We keep doing clinics, we keep doing ward rounds or whatever it is, the same old way. I think the young adult involvement here has been really different, challenging at times. They'll tell you what they think without a doubt. Mm-hmm. And it's probably, it's the challenge then is for us to try and, take that on board. And I'd love to say we have it cracked. Love to say that we have it all figured out. We don't. Yeah. But as we move along to feasibility and hopefully to pilot, I think we're keen to keep listening and keep learning from their experience.
Mm-hmm, definitely.
So we have a question online, if that's okay. So Sinead Hines has said, hello, thanks very much.
Hi, Sinead.
Very interesting. My question was in relation to the process of a PPI member finishing their tenure in the app group. Did you set a particular time frame of involvement, and did people have the option of staying on If not, how did their involvement come to an end?
Yeah, really good. I mean, I let Loughnane comment. I've been concerned right from the get-go, you know, when we first, Mary Claire O'Hara established the first young adult panel, then Deirdre, now Loughnane is leading it. And I keep, you know, asking, I hope we're not burdening these young people. You know, it's a big ask, and we, you know, it's our job. We turn up for work and we turn up for research meetings and so on. I've been really impressed at the commitment, you know, from our young adult panel. But I think Sinead's question is really spot on. This is where we are. You know, some of our young adults have been involved now for several years, and we're trying at the moment to get our head around the whole issue of rejuvenating, if that's the right word. Yeah. Loughnane, did you want to comment on that?
So really timely question, Sinead, because we had a young adult meeting. Sean and myself were in attendance with the young adult members, and this is exactly what we talked about a month ago now. So as Sean said, some of the young adults have been there from the very start. You saw the advert of 2014. So I am in the program manager role about 2 months now. So this kind of stuff was entering my head. Sean was alluding to it as well. And I just asked them straight out about, was there a time frame set? Was that kind of stuff brought out? And how are you feeling now about your roles are changing in the project and so on. Some of them are moving out of the young adult bracket age as well, which is 18 to 25. So in terms of a time frame, their answers to that was it wasn't really discussed. And I suppose maybe the reasoning behind that is because with research and research process, we don't maybe always know how long a research project is going to last as well. So the young adults would have been formed before the HRB award was actually awarded. So that could have been a contributing factor. But speaking to Sarah Simpkin in Jigsaw, she would say there's a timeline of about maximum 3 years. And to kind of set that out. So with new members now, we have now said that there is a time frame of max 3 years, and then you need to be reassessing.
What I'm hoping though is that, you know, the contribution. So if I was to predict where this is going, I think the commitment will still be there from our existing young adult panel members, and we may have a senior group of wise, you know, former YAP members, because I would hate to lose their, you know,
alumni. Really.
Absolutely. I mean, the age cutoff is, you know, not important as far as I'm concerned. It's, you know, they've lived through the 18 to 25 year, you know, experience, and they know better than any of us what that's like. So yeah, we still have to work that out. We have to be fair to people, and if they say they're, when
Sean is saying, please don't leave, I have to be behind, being like, no. So you have to ask, and you have to keep on asking, and roles are changing constantly. You might argue now is maybe a little bit of a boring time of the we're going through analysis. It's not maybe as exciting as it had been when Mary Claire was involved, and we're really developing, doing the hackathon and that kind of stuff. So roles are changing, and we need to be aware of that. We need to ask them, are they happy with that? And that. So
I think there are lessons there for any PPI group. You know, there's a lifespan with it, and I think what we've learned is that probably needs to be set out at the beginning.
Yeah, for sure. Yeah.
Catherine,
thank you so much. I'm really excited and interested in this now. Andrew has been kind of the flag so far, but it's really fascinating. And actually what you've just been talking about leads into my question, which is very important. Just what's your gut instinct about the analysis stage, and will there be, it's less, as you said, it's less glamorous maybe than some of the earlier work, and even less, it's kind of a bit more lonely in activity than data collection. Do you think, like for instance, the guy who said he didn't want to meet people, do you think there may be some people who'd like to get involved in analysis? Yeah,
I think so. Equally, the ones that will get involved, I think there'll be some that won't either. Yeah. So I haven't any experience of doing analysis yet with the app or with any sort of PPI contributors. I don't know, Molly, have you might be able to shed some light on what that's like, but I think we will definitely have one or two of those kind of shyer people that maybe this now is their time to shine in the project when they haven't, because lots of the stuff we have been doing is more the dissemination, speaking out. The focus group stuff needs some sort of requirement of being able to speak out loud as well. So I'm looking forward to that, and I think definitely if there's some way of us being able to describe or narratively describe and publish how that works, I'll get on to you and see what you think. Yeah.
I mean, maybe just something I suppose Catherine a little bit similar was trying to engage the young adults in our systematic review, which again, there's loads of that, you know, less glamorous, less interesting stuff. And I suppose what we found was the input from the young adults was really useful near the end stages around the discussion around what we make of it all. So not necessarily in doing hard grind of, the analysis required, but in the interpretation of the so what of what we found. And then I think the young adults really did have views on that, and I think maybe it may be something similar in terms of the qualitative part of the research.
Yeah, me and Emer are going to do the bulk of the bulk of the work beforehand. It'll be more when I'm not too sure yet what stage, but it might be when we have our codes and we're trying to think about team development and that kind of stuff. But I'm not too sure quite yet where they're going to get involved. But me and Emer, they're not going to be there from the transcribing to the initial coding piece. Yeah,
it's interesting. It's that thought of, okay, so a theme's been developed. Ultimately, what we call the theme and the summary statement of that, I could see being very differently interpreted by that group, and importantly so. From that perspective.
Especially, as I said, given my lack of creativity when it comes to naming themes and stuff as well, they might help out. So,
I'm just going to ask, kind of building on Molly's question. So Molly's looking at systematic reviews, and you're talking about the focus groups there. Have you looked at, or has there been any plans in the future to look at other qualitative methods, say the like even questionnaire design using the PBI, or things like context mapping, or we're doing some work on cultural probes. So we've struggled, I suppose, with the design of them, and I suppose the one we're doing next, the context mapping, is very practical, but I could see a massive benefit, and obviously including the patients in that as well. I'm just wondering if you have any plans to.
It's not anything in the plans for the minute. So I know the qualitative work up and coming for the pilot is going to be your focus group afterwards with participants and interviews afterwards with healthcare professionals. In terms of questionnaire development, thanks to Molly and Co, we have a core outcome set of well-defined outcome measures that we're going to be using. There's no need for development there, but give me a shout if you'd like some thoughts. I can come back after the analysis and see how we get on, if I can provide anything with that.
Any more questions? I have a quick one, if that's okay. I was just wondering, how do you capture the information that you get from, these bits? Like, so obviously the qualitative focus groups and stuff, you have your data recorded and you transcribe it, so you get data there. So you're not collecting data in, the app meetings and stuff, but you still get a lot of information that's really useful and that, would be helpful to document in some way. How do you manage that, or is there a way that you found that captures that information?
Yeah, at the minute I record the meetings and I have them, but I haven't thought about what to do with that. I just instinctively thought, sugar, I should be recorded. They're saying really useful things here. So instinctively did that, but there wasn't a plan in place about doing that or what I'm going to do with those recordings now. But I know Deirdre, and I'm not too sure who led on that work with Deirdre. Was it Sharon Conway? Sharon, led on looking at the involvement of the YAP. So they did do some stuff with some qualitative work with the YAP on their involvement so far.
And that's at least I haven't seen that completed yet. I think it's very near completion, but it's a good question. It's a difficult thing, how my strong sense is that our young adult panel have brought huge, have contributed hugely to this work. It can be difficult to actually
really capture
that. I mean, the meetings we have, we've mentioned Jigsaw a number of times. I think an awful lot of this is down to, the approach that they take in Jigsaw. They're extremely, open to, or they really do walk the walk of having young people shape the service. In that case, we've tried to model that in terms of shaping the research and the way it's delivered. I think we've done a reasonable job, but you're constrained sometimes as well by the methodology. And I suppose that's the tension here between listening to them, but at the same time having to deliver.
Catherine, did you want to?
Just a suggestion on that point, because there's so much valuable stuff in those recordings, and they're not part of the data for the quality, as such, but they could be used meaningfully in describing the methodology and the audit trail and the decision making through kind of documenting reflexivity, as we would do as research teams if we were working as a team on qualitative research, and we would use that reflexivity and those kind of records of our decisions to kind of add rigor to the process.
Yeah.
So you've got some wonderful opportunities through your use of PPI to add to the rigor of the study and finding a way to integrate that into methodology and writing it up. Gosh, it's brilliant.
So I think we do need to be careful. That's a nice use of it, because I think we do need to be careful that they're not participants per se. They are members. They are members of the research team. So I like that involvement. Yeah.
Sorry,
that would be my question. Maybe for that bit of work around the qualitative work that Sharon Conway has led, I think your YAP maybe became participants in that.
They did.
Which is perfectly acceptable. I think it's important not to confuse the two roles. Yeah.
Yeah.
Okay. You mentioned challenging at times. I've got a suspicion that maybe refers to the time and organising and building relationships and keeping people going. At any point, was there a voice or voices amongst the gap that were taking you in a direction you were uncomfortable with as researchers? You know, was that challenge ever there? Because certainly I've been aware of that in other studies from a PPI perspective.
I can't think of anything offhand. I could think of maybe something really minor. One girl did want to help me co-facilitate a focus group, and she's the type of individual that we just need to keep a little bit of an eye on terms of maybe her reasons maybe for being the YAP, and that piece around not feeling like they can't say something when something sensitive is brought up, or kind of contributing as opposed to being the person asking the question. So that was a slight challenge where myself and Deirdre did have to meet her and have that conversation with her, that we just felt some of her questions were a little bit leading, and just questioned and talked through that. That's probably the only challenge. I've only been here maybe the last couple of months, but the only challenge I've come across so far. Maybe you should ask them the same question about me. yeah, and Sean.
Given the level of input you've given, you're clearly doing something that keeps it open, but again, isn't creating, you know, those tensions within it when you do hear about that in other places. So there's an element of what you're doing which is working that, you know, whilst giving them freedom and input as well.
And it is challenging. It does take a lot of time as you said, and just making sure that they are still happy and they still do know what their role is in the YAP, and that can take a lot of headspace and a lot of time for the research team. Yeah.
There's one other thing. It's not altogether relevant to, I suppose, the topic of the discussion, this interface between PPI and qualitative, but you know, we've learned along the way that you need to mind your young adult panel. They've had approaches not always known to us from people to contribute to various bits and pieces, and you know, I'm sure they would have assumed that approach came because, you know, their involvement came from us. So there's a real risk, I think, of just overburdening them.
Yeah. So I'd just like to thank you all so much for the questions. It was a really brilliant session. So all the slides and the recording will be up on the Quest website, which is www.quest.ie. They'll be